So hello everyone, welcome back to Grow Med, and this is the session where we are discussing the 100 most important topics. So this will be like a kind of a quick recall for you all in the last minutes, and already uploaded part 1 and part 2 videos, so do watch that videos also, and this is the part 3 video. Okay, and the reason why I'm breaking this video into various parts like 20-30 minutes is that because if I upload a video, like if I share all the things in a complete video, it will be like lengthy 3 to 4 hour video. Okay, and it will be like tiring also. So 3 से 4 hours में कोई भी मतलब इतना ध्यान लगा के नहीं पढ़ सकता. तो आई एम ट्राइंग टू ब्रेक इट इनटू वेरियस पार्ट्स सो दैट it will be like you will be also curious कि next video कब आएंगे, and you will be getting interest उस video में, and it will also be easier for me also कि जब जब मेरे को free time मिलेगा I'll be doing that video and posting it. Okay, so we had already discussed about cataract and this retinoblastoma Wilson's disease, all the things. So today we will discuss an important topic from the Glasgow Coma scale. Okay, so the Glasgow Coma scale, we will be looking at the eye movement, then the verbal movement, that is the speech, and then the consciousness of the motor movement of the patient. Okay, EVM. And so this is the marks which we will be giving. If eyes, the patient is opening the eye spontaneously, then give a score of 4, then 3, then 2 and 1. Okay, so these are the scoring systems which you must know. Same for the speech, 5, 4, 3, 2, 1. And for the motor, so these are the scoring systems we will be giving. Okay, so if the patient is responding or obeys command, then 6. If no, then 1. ऐसे करके. So a clinical case have been repeatedly asked on this topic, giving a clinical case like कुछ भी describe कर दे देंगे like a road traffic accident, and then on examination you see that the patient is able to open his eyes spontaneously, so you will be giving a 4 mark. Then but he is making abnormal sounds, so abnormal sounds matlab ki in comprehension, so it will be 2, and the patient withdraws on the pain, so it will be 4. ऐसे करके they will give in options E, V and M, so you need to choose the right option given from the question. And so the scoring system goes like maximum score is the 15, so if you 4, 5 and then 6, so it will be the 15, and minimum scoring is the 3. Mild, we will be classifying it as the mild when the patient scoring lies between 15 and 13, moderate and the severe. So question can be asked like they will describe all the things, and they will ask what is the Glasgow coma scoring, mild, moderate or severe करके भी दे सकते हैं. ठीक है, so you need to be prepared in both the ways. Then ATLS protocol, this is also a very important topic. So what happens in this ATLS protocol? A, B, C, D, E. Airway. So first maintain the airway of the patient, and how we will be doing it. Management is the oral and ET incubation with the cuffed ET. Then breathing. So in the breathing we need to do the ventilation as well as the oxygenation of the patient, and we need to look at certain parameters, the rate and depth of the breath, then percussion and the auscultation we will be doing. Circulation is the shock, so we need to check that if the patient is there stable or unstable, whether the patient is in shock. So if he is in shock, hypovolemic shock, then we will be giving the fluids. So IV fluids we will be giving to maintain the blood pressure of the patient. Then disability, we will be looking at the Glasgow coma scale and the pupil, so as already discussed, the GCS. Then exposure to the environment, keep the patient warm. Then so these are the indications when we will be giving making the ET intubation, because in all the patients we will not be doing the ET. Okay, so as it is a little bit invasive procedure, so we will be looking at these things. If they are present in the patient, then we will go with the intubation. So airway obstruction, CNS depression, GCS less than 8, facial trauma is there. In case of maxillofacial, we need to do emergency needle cricothyroidotomy and definitive tracheostomy. So this was a PYQ, and this was asked recently in the Jan 24 exam. Okay, so the question was asked like a for a clinical case. They had described that a patient with road traffic accident came into the emergency with so and so findings, and you need to do what is the management in case of the maxillofacial trauma. So you need to look what the examiner is asking. If it is emergency, then go with the needle cricothyrotomy, and if it is definitive, then go with the tracheostomy. Then the breathing. So breathing, if the patient is having tension, pneumothorax, wide bone needle insertion, ICD, ICST, okay, then fifth intercostal space, then massive hemorrhage is there, then intercostal drainage and pulmonary contusion, we will be doing the mechanical ventilation. Okay, so these are the things which you must remember from the GCS. Then the biomedical waste management. So this is also an important from the PSM, and you can expect a question from this one in the upcoming July exam. So we discard the waste into various bags: yellow, red, white, and the blue category. So questions are asked like what things you are discarding into the yellow. So it will be the anatomical waste which we will be discarding in this. So human anatomical, then soiled waste, expired or discarded medicines, and the other. Okay, then in the red we will be doing the contaminated waste which is recyclable, and the examples are like the set, catheter, urine bags, and all those things. And in the white, sharp metals, and in the blue, glass waste. So these two are very important and frequently questions have been asked on this. And in the Jan 24, the question was that needle with syringe in which you will be discarding it. So needle with syringe will be going into the white uh, bag because it has a needle. No, needle may sharp. ठीक है, तो sharp will be going into the white. But if only they are asking about the syringe, then syringe will go into the red bag. Okay, then moving on to the hypersensitivity reactions type. So important from the patho and classified into various types 1, 2, 3, 4. So these are the examples of the uh, diseases and the hypersensitivity reaction, that which disease shows which type, and you need to like mug up this whole table because this is also a repeat topic. And questions have been asked on this allergy, that allergy is which type of hypersensitivity reaction, and questions are like asked on this also, that uh, what is the triggering factor present. So in this, the antigen, and it is the IgE mediated, whereas hypersensitivity to antibody mediated, and it is an also cytotoxic reaction. And this all the diseases you need to remember. You can remember it by a mnemonic: my blood group is Rh positive. So my से myasthenia gravis, blood transfusion, Graves disease, then good pasture, ऐसे करके. Okay, then hypersensitivity immune complex 3 immune complex mediated. So in this, the triggering factor will be the immune complex, so the combination of the antigen as well as the antibody, and associated with the fibrinoid necrosis, PYQ. Then the examples, so these are the examples of the type 3. Then type 4, so it's a cell mediated, and it is also called as a delayed because T cells will take a little bit of time to show this reaction. Okay, so the T cells and cell mediated. So question is asked that which of the following hypersensitivity reaction does not contain an antigen antibody formation. So it is the type 4 because it is directly caused by the T cells. There's no action of the antigen as well as the antibody, whereas in all the other three you can see the formation of the antigen or the antibody. So these are the examples, and this Montauk's test is a PYQ which was asked. Then this chronic graft rejection also. Okay, then national immunization schedule. So already I have uploaded a video with the name of the PSM short topics, and you need to watch that video for this complete explanation of the NIS, National Immunization Schedule. Now quickly we'll discuss what all questions have been asked from this National Immunization Schedule. So at birth you will be giving these vaccines: BCG, OPV, and the hepatitis B vaccine. Then at 6 weeks you will be giving 5 vaccines, and earlier it was the 7. So these are the names of the 5 vaccines. Then OPV 3 at 10 weeks we will be giving 3 vaccines: OPV, Penta, and the Rota. At 14 weeks we will be giving the 5 vaccines. Same, the vaccines we should be giving in the 6 weeks, those only are repeated with in the 14th week, but the dose will be altered. So 1 का हो जाएगा 3 and 2, 3 and 2. Okay, so doses will be changed. Then in the 9 month we will be giving the measles and MR, then PCVB, Japanese encephalitis, vitamin A, and the FIPV3. Okay, so this is the updated version, and earlier we used to give the other drugs, other vaccinations, like 6 weeks it was the 7th, and it was like we will be giving OPV, hepatitis B1, and then we used to give various other also. Okay, so but now it is updated, so you need to read these things. And Then in the 9th month we will be giving the vitamin A, and this is also important as in integration with the ophthalmo also and PSM also. Okay, then deficiency will be causing xerophthalmia and white hot spots. So we had already discussed these things in the last video, previous video, so do watch that video also. 6 to 24 months, again 4 vaccines we will be giving: DPT3, OPV, MR, and Japanese encephalitis. Okay, and 5th year DPT booster, 10 year TD1, and 16 years TD2 pregnancy TD. And this vitamin A given every 6 months from 9 months till 5 years. So these are the full forms, in case if do not anyone get confused or do not know about the full forms. Then the classification of the vaccine types: live, killed, toxoids, proteinaceous, polysaccharide, recombinant, and the mixed. So these are the examples which you must remember. And questions have been like asked on the live vaccines and the killed vaccines, that which of the following is the live and which of the following is the killed vaccine, and which is the recombinant, mixed, ऐसे करके questions पूछे गए. तो you need to remember this one. And just to make it easier, you can remember one thing, that these 3 are the killed. तो killed में 3 vaccines आते हैं: rabies, IPV, hepatitis A. The rest all which all are left, no, they will be coming under the live vaccines, and these vaccines are contraindicated in case of the pregnancy except yellow fever. Okay, so you can remember it like all these things contraindicated, and these are the live vaccines. Then the route, this is also important, that which vaccine is given by which route. And the nasal route, live influenza is given. Then oral, OPV, rota, typhoid, and the cholera, 2 drops, rota 5 drops is given. ID, intradermal, BCG, rabies, IPV, subcutaneous, MMR, measles, Japanese encephalitis, yellow fever, and IM. These are the drugs which we will be giving the IM. Then the lyophilized, which is the powder form. Okay, some vaccines we get in the powder form, right? So while we administer the vaccine, we need to make it in the solution form, and what additive material we will be using to make it a solution. BCG, we will be giving it under the normal saline, so additive is the NS. Yellow fever, cold physiological saline. Japanese encephalitis, PBS, phosphate buffer solution. HIV, DPT saline. Measles, MMR, distilled water. Okay. And then moving on to the contraindications, this is also important, and we had already discussed pregnancy all live except yellow fever, lactation, HIV all live. Then premature infant, HIV, epilepsy, pertussis. Then this one is a PYQ, that during epidemic post disaster, all the live vaccines, like all the vaccines are contraindicated except the measles. Then the adverse effect. So adverse effect, observation time will be 30 minutes. So after putting the vaccine, we need to observe the patient for the 30 minutes to look for any side effects from the vaccine. So OPV will be causing paralysis, hepatitis, HSR, shock, measles, TSS, febrile seizures, rota intussusception. So this was a PYQ. And then pertussis will be causing persistent crying. Killed influenza or the swine flu will be causing the GBS, Guillain-Barré syndrome, MMR, and the hepatitis B thrombocytopenia. Okay, and this is a must-know topic. So, this is a repeat topic, like asked multiple times. So, TD vaccines, and it is given in case of pregnancy. So, questions are asked like giving a clinical case: a pregnant woman, she delivered first child at this time. Now she's at this month. What if we when you will be giving the TD vaccine. Okay. So the childbirth, if it is more than 3 years, then you need to give the 2 doses, and TD1 and TD2. TD1 will be the pregnancy at the time of the pregnancy confirmation, and TD2 2 weeks later after the confirmation. Then childbirth, if it is time gap between the childbirth is less than 3, then TD booster at 7 dose 1, and here you will be giving the 2 doses. Then the storage of the vaccine. So this is also important, and frequently questions have been asked on this, and also the image based question. Okay. So Iceland refrigerator, this is the image present at the PHC. Then ice pack present used during the immunization schedule. This is the vaccine carrier, and this is used for the transport. And walk-in freezer, it is present at the state level, and will be a complete room like thing, and in that the vaccines will be stored. So if at all an image is asked, then you'll be easily able to come to it, क्योंकि वो पूरी एक room रहेगी ना, मतलब it will be a walk-in freezer. Then vaccine vial monitor, this is also a repeat topic. And what does it stands for, like VVM. So if we need to look at two things, one the outer circle and second one the inner square. So if both are, this one is light and this one is dark, then it can be used. So it is same in case of both the things. The inner square is light whereas the outer circle is dark, so that means it can be used. But if it becomes similar and you're not able to differentiate the square and the circle, and if the square gets darker than the circle, then it cannot be used. Okay. Then the open vial policy, so it is a positive, or it can be used for various vaccines, and these can be used up to 4 weeks, that is the 28 days, less than the 28 days, and these are followed by various vaccines: DPT, hepatitis B, TD, PCV, IPV, and the OPV, and these following are not followed. So these do not follow the open vial policy. And what happens in this is that you have opened the vial, okay, and you can keep this vial for like almost uh, 4 weeks, and later you can use it again. Okay, so this is one advantage of this open vial policy. That means if you have not used the vaccine completely, no मतलब इनके साथ तो ऐसा होता है कि if you have not used it you need to discard it, but in case of these things it will be like the vaccine will not get wasted and we can use it again. Then moving on to the glycogen storage diseases. Okay, so a must do topic from the pediatric, from the biochemistry, and you can expect a question from this one, glycogen storage disease. So classified into the 6 types: 1 2 3 4 5 6. These are the names: Von Girke, Pompis, Goris, Anderson, McArdle, and Hers. So this is the enzyme deficient, and you need to like mug up these things. मतलब अगर किसी ने अभी तक mug up नहीं करा है इसको, तो please अभी पेन लो, पेपर लो, start scribbling the things, और रटो इसको, कैसे भी करके इनको याद करो, ठीक है. तो वॉन गेट किस में द एंजाइम डेफिशिएंट इज द ग्लूकोज 6 फॉस्फेट, मोस्ट कॉमन टाइप सीन इन द चिल्ड्रन, एंड यू कैन सी हेपेटोमेगाली एंड हाइपोग्लाइसीमिया, दीज टू थिंग्स डिस्क्राइब्ड इन द क्लिनिकल केस. सो क्लिनिकल केस के बसवर्ड्स भी हम यहाँ पर डिस्कस कर लेते हैं: चिल्ड्रन, हेपेटो एंड हाइपोग्लाइसीमिया, एंजाइम डेफिशिएंट इज ग्लूकोज 6 फॉस्फेटेज, टाइप वॉन गेट की 1, ठीक है. So another important thing in this one case is you can see examination, HP histopathological examination of the cytoplasm, looks like a crumpled tissue paper appearance, and that can also be given in the question. Okay. Then 2 is the Pomps disease. All the organs will be affected in this case, and it is also a type of the lysosomal storage disease, acid maltase enzyme deficient. Then core is debranching and Anderson branching, whereas McArdle muscle phosphorylase, and in Hurst disease it is the liver glycogen phosphorylase which is deficient. So this McArdle is most commonly seen in the adults, and you can see exercise intolerance. So whenever these things you can see in the question, adult exercise intolerance, or exercise intolerance in different word can be described like a patient after feels weakness after strenuous exercise and comes to the emergency with weakness and fatigue, ऐसे करके they can describe. So it will be the adult exercise intolerance, McArdle muscle glycogen phosphorylase. Then in case of hers it is the liver which will be involved. Okay. Then the ETC inhibitors. So 5 complexes you need to know along with the names and the inhibitors, which compounds inhibit these ETC, and the complex one, so NADPH dehydrogenase. The inhibitors are the phenobarbital and the retinol. How will you remember it? 1 and 1. Phenobarbital 1, retinol 1. Okay. Then succinate dehydrogenase, it will be the malonate. Then 3 में cytoreductase, C, sorry, the third one वाला जो है ना, complex 3, the name of the complex is the cytoreductase, and the inhibitors of these are the BAL and the antimycin C. So this one is a repeat topic. Complex 4, cytochrome oxidase, so cyanide and the carbon monoxide, these are the inhibitors which inhibit this one, and this is a like repeat topic, favorite question of the examiners, FMG. And the 5 जो है that is called as the F0F1 particle, and the inhibitors oligomycin and the atracycloside. Okay, so you need to mark up this also, expecting a question from this also, the inhibitors on the etc. Then the other things from this electron transport chain are the uncouplers. Okay, so there are two categories of the uncouplers: physiological, pharmacological. Physiological matlab ki these are available normally in the body also, and one important is the thermogenin, PYQ, then thyroxine, free fatty acid, and the bilirubin. These are all the physiological uncouplers, whereas the pharmacological 2,4-DNP and the aspirin. So this is also a PYQ, and in the question please to look at the wordings of the question. If at all this question comes, they're asking it about the physiological or the pharmacological. Then moving on to another important thing from the biochem, that is the location of the various pathways. This is important, and they can describe like any of the pathway, and they can ask where this pathway is occurring. So let's look at it. Mitochondria, Krebs cycle, electron transport chain, ketogenesis, beta oxidation of the fatty acid, and oxidative phosphorylation. So all the catabolic reactions, like the reactions in which there is breakdown of the energy, breakdown of the ATP, that things will be occurring in the mitochondria. Okay, then cytoplasm mein those things will be occurring which are the anabolic pathways, which are the energy building pathways, like the glycolysis, glucogenesis, HMP, fatty acid synthesis, cholesterol synthesis, and the bile salt synthesis. All these things will be happening in the cytoplasm, and this one is a very important PYQ, that uh, some pathways which will be occurring in both the cytoplasm as well as the mitochondria. So there are three: urea cycle, glyconeogenesis, and heme synthesis. So you need to remember these three things, like mug up. And questions are asked like all of the following occur in the both cytoplasm or cyto as well as the mitochondria except. So they will be describing all these three things, and one exception will be given, so you need to look at the exception. Okay, then these are the list of the pathways and the rate limiting enzymes. So simply direct one liner can be asked that what is the rate limiting enzyme of this pathway, what is the rate limiting enzyme of this pathway. Okay, so this is the list, and you need to by heart all these things. Glycogen storage, we already discussed it na. Yes, we have already discussed it. Oh, it has repeated. Okay, then lipid storage diseases. So this is the categories or types of the lipid storage diseases. So Niemann-Pick, it occurs due to the deficiency of the enzyme. So this is the enzyme deficient, and sphingomyelinase enzyme will be deficient in this case. Gaucher's disease, beta glucocerebrosidase, then Cabres, beta galacto cerebrosidase, alpha galactocerebrosidase, then Tay-Sachs disease, hexosaminidase A, then Sandoff's disease, hexosaminidase A and B. Okay, so these are the things which you must remember. You need to like by heart this whole thing. And one important finding seen with this Tay-Sachs is the cherry red spot seen on the fundus examination, and this is important from the ophthalmology point of view also. Then moving on to another very important topic. So these are the diseases related to the mineral deficiency or the excess of the minerals. So repeatedly like questions have been asked, and can expect one or two questions definitely from this list. मतलब इतने से ही part में you can definitely expect 2 or 3 questions in the exam. So Kishan's disease, it is due to the deficiency of the selenium, and Cash-and-Beck disease, excess of the selenium. Menkes and the Wilson's disease, like repeat topic, favorite question of the examiners, and this ectodermatitis enteropathica also. But I am expecting that तीनों में से इस बार question आ सकता है, even the Menkes, even the Wilson's, and the ectodermatitis. ठीक है, तो अगर आ गया ना तो you'll be easily able to scoring 3 marks. Then Menkes disease copper deficiency की वजह से होता है, and the ATP gene mutation is the ATP7A involved. Then Wilson's excessive copper and ATP-B is involved. So how do you remember it? Simple है, M and A comes first, W comes later, and B comes later. ठीक है, तो 7 MAWB 7. Then this is an X-linked recessive disease, and this is an autosomal recessive. Ceruloplasmin is decreased in case of the Wilson's disease, sorry, Menkes disease, and you can see a gray kinky hair, which is the classical features seen with this Menkes disease. So gray kinky hair described, then copper deficiency described, decreased celluloplasmin described, then the answer will be the Menkes disease. Then autosomal recessive and hepatomegaly, cataract and the KF ring. So these are the ophthalmological findings, the cataract and the KF. So important from the ophthalmology also, and image based question can be asked on this. Okay. So this is about the Wilson's disease. Then acrodermatitis enteropathica. So it occurs due to the zinc deficiency, autosomal recessive, and rashes in the genital area. So image based question can be asked. So rashes and the triad of the zinc deficiency or the acrodermatitis is dermatitis, dementia, and the alopecia. So whenever all these features are described in the clinical case, you think in terms of the zinc deficiency. Then moving on to the immunoglobulins. So these are the various types of the immunoglobulins, the various types, yes, and IgG, IgM, and the IgA and the IgE. Okay, so these are the important one-liners or like things asked from this particular immunoglobulins. If it is G, then it is the present in the plasma concentration at the highest concentration. So PYQ was asked that which of the following immunoglobulin is present in the plasma at the highest concentration. It is a monomer, crosses placenta, and provides secondary immune response. Now about the A, it is a surface immunity, provides surface immunity and highest in the body secretions. Then IgM, it is a pentamer having highest molecular weight and provides primary immunity. So we know that the image of this structure of this IgM. So it looks like this, like this, like this. So five light chain and the heavy chain making together one immunoglobulin, which is the pentamer. Okay. Then IgE increases in case of allergies as well as the parasitic infectious. Okay. So this was about the immunoglobulins. Now moving on to the meningitis. So meningitis may you need to like you can expect one question from this also. This is also a repeat topic and like a must do. So इस पे तो question आएगा ही आएगा. So we all know that inflammation of the meninges. Then these are the clinical features and these are the signs which you will be looking in case of the patient. Now questions are asked on the type. ठीक है, तो these are classified into bacterial, viral, fungal and TB based on the cause and these are the causative organisms. And these are the cells which are increased in case of the particular, these are the CSF findings. Okay, so ये सारी CSF findings है. In the CSF, which kind of cells will be increased, what about the glucose and the protein, and based on this we will be coming to the diagnosis. So clinical cases are described like a patient with all these features coming to the emergency. You suspect meningitis and on examination you see some findings like neutrophil predominant, then the CSF sugar is less and the proteins are increased. So what kind of meningitis it is? So it is the bacteria. They can also ask the causative organism or they can ask the treatment. So this is the chart which you need to mug up. One important thing from this TB is it causes cobweb coagulum. So this is the image and you can see here that in the CSF some web-like feature is seen. CSF will be straw color. Then in case of the cryptococcal meningitis, so this is a repeat topic like asked multiple times. Matlab you go and analyze the paper, now you will be finding this question. Okay, so the things will be described like immunocompromised patient or AIDS positive or truck driver, and he comes with the clinical features like fever and all those things, and then on investigation you find so and so features and what will be the diagnosis. So it will be the cryptococcal. See, for cryptococcal investigation of choice is the CSF ELISA, which we will be doing, and on MRI you can see the soap bubble appearance. So this is the characteristic finding. And investigation for rapid diagnosis we will be using the India ink positivity, and you can see here that the capsulated organism. Okay, so the organism is not stained in India ink positive. The black color will be the background, so background will be stained in this India ink staining, and this is the staining used particularly for the capsulated organisms and the cryptococcus. Then bacterial meningitis. So you need to look at the age group described in the clinical case because it is very important. The causative organism is different in different groups. So neonates, it is the group B streptococci in India, but outside all around the world, I think it is E. coli. Then don't know exactly, but maybe I'm not able to recall it properly, but I think it is the E. coli. Then children may pneumococcus, adult may be pneumococcus, and then Neisseria is also an important uh, organism in the adult. So Neisseria cup classically seen with the C5C9 deficiency. This is a patho question that C5C9 deficiency will cause which of the following disease. And in case of prophylaxis in the pregnancy, we will be giving the ceftriaxone, again an important from the फार्माकोलॉजी. तो फार्मा के इंटीग्रेशन और पैथो फिर माइक्रो फिर मेडिसिन, इनके सारे इंटीग्रेशन में हमने पूरा ही मेनिंजाइटिस यहाँ पर कवर कर लिया. Then drugs which are contraindicated in case of the pregnancy, so important from the pharma. And so these are the drugs, and these are the effects that will be causing to the baby, so that's why these are contraindicated. The fluoroquinolones, they cause the cartilage damage. Tetracyclines causes teeth discoloration, and both this tetra and the doxycycline, both cycline drugs will be causing teeth discoloration and inhibition of the bone growth. Chloramphenicol, gray baby syndrome, bone marrow suppressions. This one is a PYQ, that ototoxic drug. Which of the following is the ototoxic drug? And why streptomycin is avoided in case of pregnancy? Then these are pyrinzinamide, ethambutol, teratogenic. Then ARBs and the ACE inhibitors are also avoided in case of the pregnancy. And let's discuss one important thing here, that in case of hypertensive in pregnancy, we will be using the drugs labetalol or the methyl dopa. Then diuretics are also contraindicated, and this is the reason why, decreasing the plasma volume. Carbimazole causes epilepticus cutis long. Then valproate, this is a PYQ, that it will be causing the neural tube defect. This is also a PYQ, obscene anomaly, lithium. Then vancomycin, red baby, teratogenic effect, these two teratogenic effect. Then clarithromycin, so it will be the embryo toxic. And furosemide, connectus, ethanol, fetal alcohol syndrome. And this one is also a PYQ, the phacomelia, no, they will be describing कि एक image दे देंगे, and when you see the image you will be seeing that the patient के limbs है ना, these are malformed, so that is the thalidomide, warfarin, phenytoin and the erythromycin. Okay, so these are the contraindications, and please इसको पढ़ लेना आप अच्छे से, क्योंकि अब मैं बीमार भी हूँ, तो trying to give my best that before the exam I'll provide with the best content to you all, so that your work will be reduced and you'll be easily, मतलब आराम से आप बहुत सारी high yield topics को पढ़ सको. Then these are the vectors and the diseases caused by the vectors. So image based questions are asked, and I have already uploaded a complete video on this vector and diseases, तो वो देख लेना एक बार. And this will be like a quick recall video. मतलब इसमें हम क्विकली सब डिस्कस करेंगे, उसमें थोड़ा डिटेल में समझाया गया है. So this is the image of the culex, and this mosquito will be a vector for the Japanese encephalitis and the filariasis. And in case of this next image, it is the anopheles, which gives vector for the malaria. Called as a sophisticated mosquito and sits at the angle of the 45 degree, and you can appreciate the spots on the wings here. So image में you can see these spots, right? So आराम से you can come to know that this is the anopheles, this is the culex, this is the Aedes mosquito sitting with a hunchback posture, and it causes various diseases: dengue, chikungunya, yellow fever, Zika, Rift Valley, and you need to remember all of them. Then the vector for the Kala Azar is the sandfly, image of the sandfly. Then tsetse fly, sleeping sickness. Itch mite causes scabies. So image based question was asked in for the scabies. Then the soft tick and the hard tick. So how do you identify the hard tick and the soft tick? Soft tick will not be having these hooks, and hard tick will be having the hooks, these hooks will be present, and the body will be like somewhat smaller, but in the soft tick the body will be completely oval shaped. Then Q fever relapsing and the KFT outside the India, whereas heart tick typhus, KFT, tick hemorrhagic fever, tick encephalitis. Okay, so these are the diseases caused by these various ticks. Rat flea causes bubonic plague and the endemic typhus, and the louse. So these are the diseases caused by the louse. So that's all for this vectors which you must know. Then levels of prevention, which is an important from the PSM. So we know that there are 4 levels of prevention: primordial, primary, secondary, and the tertiary. The primordial mean what we will be doing is taking the prevention before the coming of the before the occurrence of the risk factors. So risk factor be absent and before that only we are taking the precaution. And in primary the risk factor is present and we are avoiding the disease to occur. And secondary it will be like risk factor is also present, the disease has started but the disease, our main aim will be treatment of the disease and to avoid the progression of the disease. And third में क्या होता है कि the disease has already started and it's slowly progressing and our aim is to reduce the progress and reduce the complications also that will be occurring because of the disease. So questions are asked like giving various examples like wearing of the spectacles, it is a tertiary. And the screening test, तो pap smear हो गया, then mammography हो गया, all those things these come under the secondary. Then in case of the primary it will be like source reduction for the malaria, for the primordial it will be source reduction and the health education, and for primary it is these things like midday meal scheme, control of the air program, OCP, this was a PYQ. Then vaccines, this is also a PYQ. Then all these things. Okay, so these are the primary levels of prevention. So let's quickly discuss about the contraception also, and then we'll finish the video. And in the next video we will start from the cardiac tamponade and we'll discuss all the things very quickly, so that it will not be boring for you all also, and it will be like easier for me also. So contraception, so the failure of the contraception calculated by the formula called as the Pearl's index. So COCP's mechanism of action is the anovulation causes artificial period. This is the Pearl index, so the failure rate. The for all the contraception, the one marked in the yellow color and where the percent is written, so this is the failure rate and the Pearl's index. Okay, so COCPs, then progesterone only pills, then IUDs. So IUDs may classified into various generation, first, second, and third, and we will be using now third generation, the copper T. So questions have been repeatedly asked on the copper T, so do look at the things regarding this copper T. The lifespan 10 years, then this is the failure rate, and this is the image of the copper T. Then the third generation are the hormone containing, which is the progestasert. So these are the progestasert, this one and this one. Then this one is the Lipislo, which we do not use now. Then implants. So implant subdermally we will place them and they will be containing progesterone, and examples as well as the Pearl index. Sterilization techniques, vasectomy and tubectomy done for male and the female, and the site of the tubectomy is the isthmus. A short ring mechanism of action is the fibrosis and blockade of the tube. कहाँ गया? हाँ ये रहा, दिस वन. सो दिस इज द रिंग एंड यहाँ पर ये इसको प्लेस कर देंगे तो इट विल बी लाइक ब्लॉकिंग द क्या बोलते हैं यार इसको, यूटेरस नहीं, फेलोपियन ट्यूब और यूटेरस की जो कनेक्शन है ना उसको वो ब्लॉक कर देगा. तो फर्टिलाइजेशन मतलब स्पर्म यहाँ तक पहुँचेगा ही नहीं, तो फर्टिलाइजेशन होगा नहीं, फर्टिलाइजेशन नहीं होगा तो फिर कंसेप्शन नहीं होगा. Then vaginal ring. So these are the content of the vaginal ring. Asked as a PYQ that क्या क्या content है vaginal ring की. Vaginal sponge contains minoxidil-9 which is a spermicide. This is also PYQ. फिर ये इंजेक्शन प्रोजेस्टेरोन हो गया, ये इवा पैच हो गया, बैरियर्स. ठीक. सो इसमें से ना कॉन्ट्रासेप्शन में से यू नीड टू मेनली फोकस ऑन द IUDs, then the sterilization techniques, the issue ring, the vaginal sponge and this COCPs. ठीक है, barriers भी, because barriers have a highest failure rate. Then the emergency contraception. So this is we will be providing the contraception within 72 hours of unprotected intercourse, and these are the various methods available. Levonorgestrel, which is the progesterone, and it is a drug of choice. This is the dose of the tablet. फिर कॉपर COCPs का यूज में रेजिमेन है, बट अभी हम इसको यूज़ नहीं करते हैं इतना पॉपुलर. पहले के ज़माने में इट वॉज लाइक वेरी पॉपुलर. We go with the other methods. Then mifepristone, which is also called as the RU460. So this is the dose, and this dose we will be giving. IUD is effective up to 5 days, and ulipristal acetate as serum, SPRM 30 mg. Selective progesterone receptor modulator, ठीक है, ulipristal and 30 mg देंगे हम. So this was about the emergency contraception. Then the MTP Act. So this MTP Act is also important from the forensic medicine as well as the OBG. And questions are asked like based on the weeks की किस week में हम किस women को contraception दे सकते हैं, and the opinion of the doctors required, like the age limit. So earlier in the 1971 it was 20 weeks, but now in the 21 this is asked now in the exams. 24 weeks for rape survivors, then beyond 24 for the embryological abnormalities. So fetal anomalies के लिए more than 24 weeks, and this is the opinion of the doctor based on the RMP 20 weeks, then 1 RMP, then more than 20 to 24 weeks to registered medical practitioners opinion is required, and after 24 medical board. Okay, so this one is from the MTP Act. So that's all in this video, guys. So in the next video, hope I will be able to complete it soon, so that you will also get a lot of time to watch these videos. Okay, and I know that we exam to pass mein hai hi, and you all want to travel like to other places to give the exams. So during your travel time also it will be like easier for you all, because ज़्यादा कुछ करना नहीं है आपको during your travel. You just watch these videos and try to recall the points. And another one important thing which I want to say is in the last days, like on the July 5th, please don't try to read much. Just read for 2-3 hours. जितना एग्जाम का टाइम है उसी आवर में पढ़ लेना, लाइक सुबह 9 से 11:30 पढ़ लेना, एंड देन आफ्टरवर्ड्स 2:30 से 4:30 तक इतना ही पढ़ना, बिकॉज यू नो माइंड को फ्री रखना भी बहुत ज़्यादा ज़रूरी है ताकि वो एग्ज़ाम के दिन में अच्छे से काम करे. ओके, so that's all in this video, guys. Thank you so much for watching this video. Stay tuned for more amazing videos, and all the best for the FMG. So thank you so much. I am Dr. Padmini, your mentor for the FMG.